You can be a poorly run facility. You can be a well-run facility that is ultimately going to make a difference. But even in well-run facilities, Americans are dying in huge numbers in concentrated places that we can see and identify and help if we choose. I mean, where we are counting the deaths in nursing homes, it turns out that nursing home deaths are often the majority of people who are dying in a particular region or a particular state. Mostly, though, we're just not counting them. The federal government is not tracking this. And if the federal government isn't tracking this, then, states or even local communities are going to have to figure out a way to help these places, to get medical staff in there. Not all nursing facilities have a lot of medical staff, but they need them now. They need medical staff added to the regular rota of people who they've got working in those facilities. They need medical help. They need protocols for how to handle this right and supplies to be able to fulfill those protocols. They need priority and regular access to testing. They need to be visible and connected to the larger healthcare response that we are seeing in the hospitals, but that we are not seeing in these places. When the police chief there from that town where they have had 68 dead, where they had to come in and haul out 14 bodies of overflow from the morgue this week because they got an anonymous tip about bodies stacking up. When that police chief said that these people are just as much on the front line of this pandemic as the nurses and the doctors who we are applauding every night from our windowsills, that's exactly right, except they, in some cases, are dealing with more death, with less equipment, with less training, and with no visibility and no help. I mean, the federal government should be doing this. They're not. We can't wait for them to start doing it while we let this many Americans die every day. And some places are trying. The Democratic congressman who represents that part of New Jersey where that facility is, where we just heard from the mayor and the police chief, he says that when he got a call in his office asking that facility to please source body bags, he says he asked FEMA, he called FEMA to inquire about please maybe sending in some National Guard medics to that facility. That's an option. FEMA does not seem to have reacted to that request, but that request was reportedly made. In New York State, New York's Governor Andrew Cuomo has this week started to announce every day the number of deaths specifically in nursing homes. When he announces the total state death toll, he goes out of his way to say how many of those were in nursing homes. He's starting to get more and more pointed questions about nursing home death tolls and which facilities need the most help. Maryland and Virginia, the governors in those two states, one Democrat and one Republican, have formed state task forces. They've joined forces there in those two adjoining states to form these multi-agency task forces, including the National Guard, to go into nursing homes, to try to assess crisis situations, to try to prioritize supplies into those facilities, to try to organize help. The mayor of Seattle this week, Seattle's been so hard hit. She this week asked firefighters to take over testing in nursing homes, which is one way of making sure that nursing homes are priority testing sites. Firefighters had tested first responders in Seattle as priority testing targets. Now she's asking firefighters to please target nursing homes. In the great state of Michigan, which has the third largest number of cases in the country, the governor of Michigan just in the past day signed a statewide executive order that directs nursing homes in Michigan to start reporting any COVID cases among staff or patients to the health department, to create separate housing for residents with coronavirus, to provide PPE to all employees who are working with any coronavirus patients, to send any medically unstable patient to the hospital. Her executive order covers a number of things that nursing homes need to do better and that they need help with in order to stop the tide of death through these facilities where more Americans are dying than in any other place. Well, today, interesting development in Ireland. Today, Ireland's chief medical officer announced some good news about what they've done so far in that country, but also some very serious news about what they're going to be doing moving ahead. The chief medical officer for Ireland today put out this statement. Quote, "The first task for Ireland was to suppress the virus in the population at large. We are increasingly confident that we are achieving this. All of our efforts now need to be on extinguishing COVID-19 in our community residential settings, including nursing homes." I mentioned that Ireland has fewer than 500 deaths so far nationwide. The official death toll there as of today is 486 deaths, which is, as I said, a tragedy for all 486 of those deaths. It is a good news statistic compared to other European countries and compared to where the United States is and is heading. But the Irish government isn't just looking at their death toll in aggregate. They are counting where people have been dying inside Ireland. And so the Irish government also knows and has announced that of the 486 deaths they've had nationwide, more than 250 of them are nursing home deaths, more than half of their national total. And so, having had pretty good success tackling big picture population-wide measures to keep the epidemic overall as small as possible, they are keeping those measures in place. The Irish Prime Minister today announcing that those measures that they've put in place to slow the spread of the virus, they will stay in place into May. But they're confident that they're having good success there. That's why they're keeping it in place, because they know that it's working. But as they are keeping that in place, they now have a new priority number one. They are now refocusing their entire national response to try to save the most lives now, by focusing on the place where the most lives are being lost now, by focusing on nursing homes. The Prime Minister announcing that the government will be providing to nursing homes additional funding, additional staffing. They're also making nursing homes priority sites for coronavirus testing. Nursing home staff and patients will have priority access to testing above other population groups. They are also, as a government, redeploying senior staff from the Irish Medical Service to improve infectious disease control measures in nursing homes nationwide. And as of yesterday, they have announced terms of a new agreement in which the government of Ireland is asking health workers who are currently working in hospitals and clinics and other places in the Irish Health Service. They're asking health professionals to please volunteer to start working in the nation's nursing homes instead. Even the privately owned ones, where regular medical staff from the National Health Service wouldn't usually work. The government will pay these health workers salaries for them to start working at nursing homes. The government has agreed to provide all the PPE, all the personal protective equipment those health workers will need to work in nursing home environments. And this new deal just announced by the Irish government is not just for doctors and nurses, although it is for them. The government is also asking for healthcare assistants and cleaning staff and even catering staff to volunteer to do the same. More than half of their deaths in their country from this epidemic are their elders in nursing homes of all kinds, including those run by private businesses and charities. But the government recognizes that that's where they're losing the most of their citizens to this virus. And so, therefore, it has become priority one for that national government to surge resources and staff and expertise into those facilities, to break existing rules about who works where, to take responsibility for paying the people who need to be in there to do it, to repurpose resources from other places, to get those places in the front of mind, to put those places in the bullseye in terms of where resources are being targeted and where the most energy is being expended to try to save the most people who are at the most risk of dying. That's what they are now doing in Ireland. We could do that. I mean, just imagine. We could do that too. And it would make just as much sense to do it here as it would there, as it would anywhere. Where are you moving? Where are you losing the most lives? And where are you slated to lose the most lives as this thing moves forward? Focus there to save the most lives. We could do that. I don't think we're going to do it at the national level, not with this government. The Trump administration at this point is refusing to even monitor the situation in American nursing homes, let alone provide them resources to fight this thing. Hell, they're not even giving them individualized guidance on how to fight coronavirus. They're just letting nursing homes figure it out themselves. Good luck, and maybe not even that. But I know some states are starting to try to take this seriously. So maybe individual states could try that Irish model. Maybe groups of counties could try this together. Maybe small consortiums of states could get together and try this regionally, if that's easier than individual states trying to do it on their own, or individual municipalities and counties trying to do it on their own. I don't know how the economies of scale work here and whether this is easier to do on a smaller scale or a larger one. But we've got to try something, because it can't just keep going like this. Nursing homes can't be left to just do this on their own. Can you just give our viewers a sense of where you think you are in terms of your position on the curve, and what you're most worried about in terms of the impact of the epidemic in your state in the coming weeks?
Sure. So, we have taken an aggressive stay-home order stance, similar to a lot of other states right around us, both Republican-led and Democratic-led. This is not a partisan issue. COVID-19 does not respect party lines or state lines, and that's why we've all got to be in this together. What we've seen is the curve looks as though it's flattening. We're pushing the curve down. That means we're saving lives. That means we've saved our healthcare system from being completely overrun and inundated. That means fewer people are getting sick. It comes with a sacrifice. There's no question. All people are making this sacrifice right now. But I think the thing that I'm concerned most about, and that I think my fellow governors are as well, is a resurgence. When you see a political rally, that's what it was yesterday. A political rally like that, where people aren't wearing masks and they're in close quarters and they are touching one another, that's precisely what makes this kind of a disease drag out and expose more people. People came and converged together in Lansing, and then they went out back to their homes across the state of Michigan. The odds are very high that they're spreading COVID-19 along with it. And so it's that kind of irresponsible action that puts us in this situation where we might have to actually think about extending stay-home orders, which is supposedly what they were protesting.
Governor, I have to ask you, and I'm sure you know it's coming. I know that it's probably all the national discussion about you has probably been a distraction while you were dealing with this crisis in your state. But as Joe Biden enters into the phase of his candidacy in which he needs to be thinking about a running mate, a lot of people have talked about you. If Vice President Biden asked you to be his running mate, would you say yes?
Rachel, I'm not going to even go there with you. I've got my hands full with COVID-19 and trying to save lives in the state of Michigan. This is the job that I worked for 2 years to get. I am grateful even on these hardest days where there's rallies outside my window, where I'm worried about the health of the people rallying, and I'm on the Zoom with healthcare providers who are telling me about cold storage and efforts that they have to do Herculean efforts that they're making to save lives. And so I'm not thinking about politics right now. I am focused 100% trying to do the best I can as the governor of Michigan. And I appreciate your effort, but I'm not going there with you.